Okay, so today I'm going to be presenting on psychosocial intervention for sports injuries and illnesses. So there are different responses to an injury. Each athlete is going to respond differently depending on just their personality, the severity of the injury, and other factors as well. So some of these might require them to feel like it is a setback. They might think, okay, well, I'm not going to be able to play for this amount of time. I'm not going to be able to get better. I'm going to lose skills, fall behind my other teammates, and it can be super frustrating for them. Other athletes might see this as a break from sports. Some athletes can feel super overworked, which could have been the cause of the injury in the first place, and they might view this as an opportunity to take some time off, maybe mentally regain some strength, and then come back when they're healed and ready. The third reaction to an injury is motivation. So the athlete might think, okay, I got injured, but I'm going to take this as an opportunity to get stronger, show a lot of bravery, and just work super hard to get back into my sport and come back better than I was before the injury. And then, like I said, the severity of the injury is going to dictate the feelings and the emotions of the athlete. Okay, so more responses to the injury. There are going to be different categories of injuries. So we have a short-term injury, which will be about 4 weeks. This could be something like a mild sprain. It could be a mild concussion, something that a doctor is just on caution of maybe seeing how they feel for a couple of weeks before allowing them back into a sport. Usually not a super big deal, so bummer for athletes, a little frustrating or scary that it could worsen, but usually this is best case scenario with an injury. You also have long-term injury, so 6 months to a year. This is going to be something that's probably going to require surgery. So ACL tear, labral tear, a slip disc maybe, or a broken bone. So this is going to be something that will require getting an operation to fix it and then going through the rehabilitation process to get back, which is usually 6 months to a year. Sometimes longer, sometimes a little shorter. Then we have chronic injury. So this is going to be recurring. And this will be something that could be an athlete that's dealing with sciatica or let's see, something like chronic ankle instability, things where they know and are aware of the injury and it's something that happens repetitively. Um, Sometimes this is something that can be treated and managed for the athlete to tolerate so that they can still participate in their sport. Sometimes it is not. And that could lead to the fourth response to injury. So this is going to be a terminating injury, which will probably end their career. For example, my sister, she has torn both of her ACLs, both of her meniscuses, and she's just had, I think she's had 5 total knee surgeries. She played soccer. She definitely had so much cartilage damage and just instability in her knees where it wasn't safe to allow her to play. So there are other injuries that are more severe, like paralysis. Obviously, you're not going to be able to participate in your sport with something that severe. This is something where she is still able to participate in activity, like physical activity, but um, a sport that is contact, involves twisting or planting, is not going to be a safe environment for her and her injuries that she's had. So something like that would be terminating and ending the career. Then we have the reactive phases during rehabilitation. So first, there's going to be the reaction to the injury, how the athlete responds to what happened, their feelings, their emotions. Then there's going to be the reaction to the rehabilitation. So if someone gets injured, they might be like super high pain tolerance, thinking, okay, something might be wrong, but I'm okay. I'm going to push through it. Then you find out you're injured, you find out how long it's going to take, you go through the rehabilitation process, and it can be quite frustrating for some, um, especially those who have never had an injury before, don't know the process, or even those who have had an injury before and they're going through it again. Um, and then the reaction to return to play or termination of the career. To play can be exciting. It can also be nerve wracking for some. I recently had shoulder surgery, and my 6 months is coming up in May. And it's a little bit nerve wracking to be cleared and be able to do something that I haven't done for 6 months, or even before my 6 months started before my surgery. But there's also that excitement aspect where it's time to finally get back to what you love to do. So there's definitely a range of emotions there. And then for termination of career, 99% of the time, it's going to be not a positive reaction. Um, if someone wanted to get out of a sport that badly, then maybe there's that slight weight off their shoulders. But if it's terminating their career, then it's probably an injury that is affecting other things in their life than just that sport not being a part of it anymore. So there's definitely going to be a reaction to both of those experiences. And then we should just make sure that athletic trainers are attentive to different responses. It's important to support the athlete and understand that everyone's going to react differently. So just being aware and able to respond to different athletes, different personalities, and different responses to injury. Okay, the integrated model of psychological response to injury. So this is going to focus on personal and situational factors influencing cognitive appraisal of the injury. And then that's going to determine the emotional and behavioral responses of the athlete. So the three primary cognitive appraisal categories are going to be irrelevant, benign positive, and then stressful, which could lead to harm, loss, threat, or challenge for the athlete. Continuing that, the secondary appraisals involve making sense of managing the injury situation. I'm going to move this over here. There we go. And then the emotional responses. So the athlete adjusts perceptions of self or others during lengthy rehabilitation. So I kind of mentioned this before. Whether this is an athlete who is injured for the first time or has been injured before, they're probably going to get frustrated at some point during the rehabilitation process. Either it's not going as planned, there's setbacks, they aren't making progress, it's hard, it's painful, whatever that might be. They're missing out on the season. Various reasons can play into that. Then they're going to confront a range of emotions throughout the rehabilitation phase. So that's kind of what I just said, just in different words. The behavioral responses, so actions resulting from reactions to injury. This can facilitate or interfere with healing and recovery. Your mental state is going to play a big role in the rehabilitation process and just the injury recovery overall. Examples are going to include adherence to rehabilitation, use of psychosocial strategies, social support, risk-taking behaviors, and lifestyle habits like sleep and nutrition. It's all mental for sure. So if you're really struggling and it's not being addressed, it's probably going to get worse and worse. And things in your life that aren't related to the injury are going to start becoming a problem as well. Okay. The camera on my laptop isn't working, so I'm filming this on my phone, but I have my screen recording and I'm going to add it in. So yeah, that's why I keep moving my phone around so I can see my screen. Okay, so the biopsychosocial model. So this is going to consider biological, psychological, and social factors in injury response. Biological factors are going to be the physical condition, the injuries, and the nerve function. So this will be the actual structure and anatomy of what's going on in the body of the athlete. Psychological is going to be personality and past experiences. So talked a lot about mentality of athletes during an injury, And that's what this is going to be. And then past experience. Have you been injured? Have you not? Have you had a history of something that's related to this? Um, Anything in the past history that could affect the injury now. Then we have social, so influence on others, and also possibly cultural beliefs, is something that the book talked about. So influence on others, I think, is interesting. You have friends sometimes who don't understand what it's like to be injured. You have friends or peers that don't understand the seriousness of being a collegiate athlete or professional athlete or maybe even just a high school athlete, something um, like that. So people are going to react differently, and sometimes they don't know how to react or they don't know how to help somebody through that situation if they don't understand it or haven't been through it themselves. So that's something that can affect athletes because they want to have that support from people that are important to them in their lives. Okay, I'm not exactly sure how to pronounce this, but I think it's the Kubler-Ross model. It might be Kubler. I'm not sure. This is going to be adapt stages of psychological reactions to injury. So this could be denial, anger, bargaining, depression, acceptance. We've talked about this in class a lot. During the rehabilitation process, bargaining is a big one. It's if I do my exercises, can I play this weekend? Or if I take 2 days off, can I play in the game this weekend? Something like that. Depression, we've talked about this throughout the whole presentation so far. Just the mentality of the athlete can become super low and they can struggle a lot with it. And they may experience some feelings of depression or anger, maybe some anxiety about it. The athlete's probably going to be in denial for a little bit about the injury. They will probably feel that they're they're fine. They can play. It's just a sprained ankle or it's just a torn ligament, something. Um, but in the end, at some point, they're gonna have to accept, okay, here's the deal. If I want to play again, I have to follow the rehabilitation process. I have to listen to healthcare providers and do what I need to do to not be injured anymore. Okay, then we have social dynamics in rehabilitation. So the injured athletes may feel isolated. Um, from a personal standpoint, you go to practice when you're injured and you can't participate. So you're sitting there on the sides all by yourself. Um, and it's not fun. It definitely is frustrating. It's kind of an interesting experience to evaluate your peers um, for a duration of time and not be able to participate, and you notice a lot of things. So, in a way, it is also teaching the athlete about their sport a little bit more and their peers. But you can definitely feel that isolation of not being a part of your team or being held back. Coaches and teammates may distance themselves. Some coaches react to injuries in a negative way. They see it as a weakness or they see it as not that it's the athlete's fault, but that, well, you're injured, so you can't participate anymore. Um, and so it's like they're a little bit less important to them or the team. Teammates may distance themselves for reasons of it can be frustrating when a teammate gets injured. It can mess up the dynamic of the team, of how they play. But, that's not the athlete's fault for getting injured. Um, and so it definitely isn't great if coaches or teammates are distancing themselves, but hopefully they are being supportive the way that they can, but still, working hard and letting the team strive without this athlete now. Struggles to maintain relationships within the team, same thing. Just if they're distancing themselves, they might be frustrated with this athlete. That can affect the relationship between them and make it feel a little bit awkward or the athlete that's injured might not really know what to do because they're thinking like, this isn't my fault. It sucks for me too. Um, so, and then involvement with the team can reduce isolation and guilt. Definitely, an athlete should strive to still show up to practice, still participate in any like extracurricular activities that the team does, and just try to participate and be there as much as possible. One, just to be surrounded by a group of people that are going to be supportive, but also just to show that, like, to coaches and teammates, like, I do want to be here and I'm doing the best I can right now with what I'm going through. The athletes need social support. So, support groups or mentorship can alleviate the loss of social support post injury. This would be something if an athlete is truly, truly struggling mentally and becomes super isolated and needs that support from someone that they're not getting on their own or in their normal day-to-day lives. Athletes rely on teammates support to maintain self-esteem and identity. So hopefully the teammates are still being there for the injured athlete and just wanting them to come back, talking to them still, and everyone's just on good terms. Support groups should emphasize athletes' value both as individuals and team members. Um, and then the relationship with athletic trainers. So it's vital for the successful rehabilitation. If you're a collegiate athlete, you are going to be working with the athletic trainer through your rehabilitation process. Most likely, they're not going to be sent to a PT or another place for rehabilitation unless there was like a specific type of rehab that this athletic trainer wanted them to do that wasn't provided through the school. But because of that, it's very important for the athletic trainer to be involved in the athlete's well-being as well as their injury and their rehabilitation process, and just being aware of how to react to that. Building the relationship may be challenging, but it is your job to give the athlete support, the support that they need to get back to where they were before, and hopefully stronger and better. Reintegration into the team. So transitioning back into the sport is definitely exciting and can also be a little bit difficult. Sorry, my video cut me off. The rehabilitation. Sorry, my video cut me off. So the entering back into a sport after being injured is going to be difficult for the athlete. So I talked about this at the very beginning of the presentation, and you can be excited about it, but you can also be a little nervous. Athletes could also be a little bit eager to get back and want to do everything right away. Hopefully, throughout the rehabilitation process, they were being gradually, like, progressively getting back into their sport at a good pace. But sometimes that's not always something that is started for X amount of months. So whenever they are easing back into their sport, it's definitely important to just notice how they're reacting, making sure and checking in that they're doing okay and that they're being safe after this injury. So athletic trainers' role in providing social support. They're definitely a pivotal post-injury contact. So if there's ever, hey, I'm still having pain, hey, this is hurting, or if it's a positive thing, hey, I feel great. Just communicating with the athletic trainer is very important. Sometimes the athletes don't understand that, or they forget, or they have a lot going on. So it's definitely important for the athletic trainer to follow up, check in with their athlete, make sure that they are where they need to be physically and emotionally. Active listening and empathy help understand athletes' emotional states, addressing fear, anger, and anxiety. So, same thing, just being there for the athlete, understanding where their mindset's at, and addressing as needed. Simplifying injury explanations and managing stress to aid at rehabilitation compliance. So athletes don't always understand the language of someone who works in healthcare. It's definitely important to break it down for them, make sure that they understand what actually is going on in their body, or the injured area, so that they can be aware of their own bodies. Having that understanding is going to help you and the athlete understand how to work together to provide the best support and best rehabilitation process. And then they support the athletes through transitions, help them navigate challenges, shift from sports to rehabilitation, just by understanding. So, same thing, very repetitive, but just through each process of the MOI to the rehabilitation process or surgery or treatment, and then hopefully getting back into the sport, or if it's career ending, just being there through every single transition and being able to navigate that with them. Okay, prediction of an injury. So some athletes are going to exhibit repeated injury patterns. These could be due to psychological traits like risk taking. There's not a single personality type that is recognized as injury prone. I'm actually kind of curious about what injury prone means. Obviously, there are diseases like brittle bones or scurvy or things like that that if you do certain things, you're more likely to injure them. But when people say, "Oh, I'm injury prone," is that like slang or is that like something that is not a real thing? So that's something I kind of want to research a little bit more. Because there are athletes that are going to come in and say, "This hurts today," and then tomorrow it's going to be something totally different, and that other thing that was hurting yesterday is going to be totally fine. With that, it's going to be hard to dictate what pain is real and what pain is in their head, maybe. So other factors that include reserved or apprehensive players lacking coping skills and playing through injuries due to anxiety or guilt. So, like I said, not a single type of personality is going to be injury prone, but just having maybe an anxiety about getting injured. The mind is very powerful and can convince you of anything. So it's important to talk to your athlete, figure out why do you think you're having this pain, figure out when it started, asking them the questions that you need to have the information to treat them, knowing the severity of the injury, or maybe it's just a pain that they're having um, that day. Stress and risk of injury. So, stress types we have positive or negative. So, when you're doing a special test, you're going to see if it causes pain, or if you feel something or they feel something, it's going to be positive test. If there's no pain, it feels normal, it'll be negative. And this is something that should also be comparative bilaterally. High stress increases injury risk. If athletes are stressed about getting injured, stressed about school, stressed about anything in their lives, their body feels that. Your bodies are going to feel every emotion that is going on in your life, and this is going to increase your injury risk because it's causing you to push through a physical environment when you don't feel 100% or ready to do that. Stress management. So balanced stress is vital for health, like I just said. It can lead to injury. So it's important to recognize stress, figure out, okay, it's time to play, it's time to practice. How do I set this stress aside and deal with it later so that I'm not putting myself at risk right now? And then athletes experience physical stress. So before we kind of talked about how athletes can be injury prone. They might not be experiencing an injury, they might be experiencing a physical stress. Athletes come in a lot and complain about my hamstrings are so tight, or my shoulder really hurts. I work with basketball players. Yeah, your shoulders are going to hurt. We've had a lot of patellar tendonitis this year, and not that they're not injuries, I would say, but it's a physical stress being put on the body So understanding the difference between that is important for the athletic trainer to decide um, course of treatment and how severe the pain is for the athlete. Emotional impact. So sports induced stress affecting performance. You can definitely tell when somebody is having like a mental day. They're just feeling down. Their personality is a little bit different at practice. Their energy level might be different, and this is going to affect their performance and how they are playing. So it's definitely important to maybe talk to the athlete and be like, "Hey, I noticed this. Is something going on?" If they don't want to talk about it, just remind them, like, um, you know, it's important to not be stressed when you're out there for your safety, um, and something that needs to be dealt with before practice or outside of games. Emotional changes signal underlying stressors. Um, Same thing. Athletic trainers' role. Recognize the and address athletes' emotions. So, referring the to for proper management. So, like I was saying, through all of these, the athletic trainer's job is to be aware and attentive to the athlete's mindset as well. It's very important throughout the rehabilitation process and just every single day practice. You'll definitely get to know your athletes very well. You're with them every single day, traveling with them, talking to them, treating them. And so I feel like it gets very easy to tell in practice, hey, this person is not great today. You just know. So being able to address that when it seems appropriate and necessary. Okay, sorry, my camera stopped again. Um, but yes, addressing an athlete's emotions when needed is definitely important to recognize. Overtraining. So, overtraining is going to be a result from imbalance between physical load and coping capacity. So, physiological and psychological factors contribute to this, and it leads to staleness and burnout due to excessive training. I see this a lot. Um, Sometimes it's due to a strength and conditioning coach. Sometimes it's due to head coaches. Sometimes it's due to parents. Sometimes it's just due to the athlete and their competitive culture or some other underlying effect. Staleness symptoms. So, performance decline, chronic fatigue, loss of appetite, increased heart rate, adrenal exhaustion signs. So, this is going to be what's happening when they are overtraining, overworking themselves, doing too much. And these are going to be symptoms to look for in the athletes. Management. So, recognizing and addressing early. If you're noticing this, definitely maybe talk to the strength and conditioning coach first. Hey, what's the workout you have this week? Or what's been the schedule, or how has this specific athlete been performing in sessions with you? Get some background information first before addressing it with the athlete. If the strength and conditioning coach has only positive things to say, maybe this athlete is doing extra things on their own, pushing them so hard, and then it's causing them to experience these symptoms. Reduce workload, allow recovery, gradual reintroduction training, halt competition. So if it's severe enough, then maybe they do need to step back for a second, reevaluate before participating again. And then burnout, physical and emotional exhaustion, negative self concept, depersonalization, depressed mood. I think every athlete will experience this at some point, whether it is mild or severe or anywhere in between. Athletes are going to get caught up in the competition part of their sport, and they're going to push themselves so hard, usually, that at some point they will experience a burnout. Reacting to athletes with injuries. So, referral for psychological needs. Athletic trainers refer athletes to sports psychologists or counselors for psychological support. This would probably be something that the athlete would come to the athletic trainer for. If they felt that there was something in their lives that they could not cope with on their own or work on outside of their sport, they might reach out and ask for a counselor. I know that UVU has a health coach for athletics. I don't know if that's a common thing at other universities, but I think that's actually really great. And we have our athletes attend um, health and wellness day with the health coach. I think it's like once a semester so that they get some information and just know if you're feeling this way, this is where you can reach out. Personalized approach. Respond to injured athletes as individuals, not just injuries. So we've talked about this, recognizing the mentality of an athlete, not just their injuries. Provide comfort, care, and communication during emotional distress. Honest and supportive care. So healthcare providers should be honest, supportive, and respectful. This seems pretty standard. Just giving quality care to your athletes. Show that you want to be there, you care about them and their wellness, and that you want to work with them and not against them. You don't want to be telling them, I'm sorry, you can't play today. Sorry, you can't play this season. Understand the athlete's coping mechanism and address concerns about recovery, surgery, re-injury, and retirement. This kind of is a nice statement that ties in everything we've talked about so far. So we're understanding how this athlete is reacting to first the injury, then the surgery, the recovery, possible re-injury, or possible retirement. So this is just knowing all of these different phases and being able to talk the athlete through the transitions. Effects on athletic trainers. So this could result in permanent functional disability. As an athletic trainer or healthcare worker in general, it can be difficult to tell an athlete the seriousness of their injury. It's not a fun part of the job to give bad news. This requires intervention for psychological impact in coping during medical treatment. Athletic trainer arranges psychologist and psychiatric consultation, considers effects on other team members, psychological effects on athletic trainer. So the athletic trainer may develop a special relationship with athletes. Injury to athletes affects trainers emotionally. Having a relationship with your athletes can be very beneficial to your job and being able to get positive feedback and positive outcomes through a rehabilitation process. But it can be difficult for the athletic trainer to see athletes not be able to strive in their sport for a season or a duration of time. Trainers make decisions based on professional knowledge. So with that, it is important to never let it affect what should be medically decided. There can't be an emotional attachment. It's important to develop professional relationships with the athletes so that you care about them and you want what's best for them. Talking to them about their lives and just who they are as people is great and definitely important in building those relationships. But not getting emotionally attached is going to be vital, especially when it comes to an injury. And then trainers may require counseling to manage their own emotional, psychological responses to injuries. I haven't seen something like this, but I'm sure that it happens where an athletic trainer is very attached to a specific athlete. Maybe it's the opposite and they struggle with this athlete and this athlete is struggling with them and they don't know how to find a solid relationship between them to have a good dynamic throughout the rehabilitation process. So it could be important for the trainers to recognize their own health throughout the rehabilitation process of an athlete's injury. Psychological factors in rehabilitation processes. So the rehabilitation process success depends on rapport, cooperation, and education. Patients need to trust trainers and actively participate, and patience and motivation are crucial for recovery. I've seen in the PT environment that it can be difficult to get your patients to do their exercises, especially when you have an at-home program. So part of it is on the athlete. definitely, as the athletic trainer, be following up, be giving very clear instructions, but at some point, the athletes have to be responsible for themselves. Psychological approaches: immediate post injury, administer emotional first aid, provide accurate diagnosis, involve patient in rehabilitation. Post operative period, explain healing phases, encourage aerobic conditioning. If you've had an operation, then you know that it's very slow at first. For myself, the first 4 months or 3 months felt extremely slow, and I felt like I made zero progress. At about 4 months, I felt like we were hitting the ground running. I got a workout program. I was able to start lifting weight quicker. Um, and it definitely was going a lot better. So for them to understand that, hey, at first, for a little while, it's going to be difficult. You're not going to be able to do what you want to do. Rehabilitation period, emphasize patient control, set realistic goals, provide positive reinforcement. I love the idea of setting goals. This is something I did for myself. At this point, I want to be able to do this. At this point, I want to be able to do this. And reevaluating throughout the rehabilitation process. Okay, is this goal still realistic? It gives the player something to look forward to in a more short period of time. Return to activity, progress incrementally, address anxiety, use baseline tests for readiness assessment. So this will be something where once the athlete is starting to build up their strength and they're at that point of the rehabilitation process, you can start integrating functional testing. So this will be something like, for example, for basketball players, we have them start doing just like skipping drills or side-to-side movement. We'll have them stand on one foot and throw a ball at them, things like that. Just start to get them kind of moving a little bit more rather than sitting and moving, dorsiflexion, plantar flexion, inversion, eversion. Goal setting. I just talked about this, so I won't go into it too much, but definitely motivates the athlete, gives them something to look forward to, and can give them some shorter milestones that they can reach instead of just saying, okay, the end of this is not for a year. Maybe the end of this phase is going to be at 3 months. The end of this phase is going to be at 6 months. Psychological skills and training techniques. So the psychological skills training benefits injured athletes. Techniques like meditation and progressive relaxation reduce tension. Coping with pain involves muscle relaxation, diversion, and altered pain sensation. This is probably something that you would have to go to a psychologist for, I think. I think that these are skills that healthcare workers aren't familiar with as well. So this could be something that athletes could benefit from to relax their bodies physically, but also relax their minds and get into a good headspace throughout the rehabilitation process. Then we have mental disorders. So mental illness affects behavior and cognition, common in society, impacting 1 in 4 to 5. Athletic trainers should collaborate and with administrators for student athletes' mental support, health support. So they can affect. I'm so sorry. They can be considered mood disorders, anxiety, or oh my gosh, I can't speak. Mood disorders, or anxiety disorders, or personality disorders. Each of these are going to have different severities throughout them. So mood disorders, maybe depression, bipolar disorder affects their mood. Anxiety would be maybe panic attacks or phobias. And then personality disorders are going to be long-standing disturbances. This could be like paranoia, OCD. Yeah. All right, then we have some review questions. So what is the importance of psychology to sports injuries? Describe the physical, emotional, social, and self-concept factors in sports injuries. As an athletic trainer, how would you psychologically assist the athlete who is about to undergo major knee surgery? Discuss psychological problems common to the rehabilitation process and possible ways of intervening. and what psychological skills training techniques might be employed to assist the athlete who is fearful and anxious. All of these questions definitely are found throughout this PowerPoint and this presentation. Hopefully that this was beneficial to you and you were able to understand what I was trying to convey. And I hope you enjoyed my presentation. So thank you.